Hello friends, let us now learn about the splenic nodules, nodular splenic lesion. So nodular splenic lesion, we have different causes of nodular splenic lesion, and among them, first most important is mycobacteria or mycobacterial tuberculosis. So if the patient has any active tuberculosis, okay, this active tuberculosis, normally if you see TB will infect the lungs normally. But there are two important conditions where the tuberculosis can infect the spleen. Like for example, if the patient has any miliary dissemination, either if the patient has miliary dissemination, that is miliary tuberculosis, or if the patient has either atypical mycobacterial infections. Okay, either miliary tuberculosis or atypical mycobacterial infections or atypical mycobacterial infections leading to miliary dissemination or normal tuberculosis which is leading to miliary dissemination. So, whenever there is miliary dissemination, this is the most common cause of nodules in spleen. So if there is any nodules in spleen and if the patient has tuberculosis history, then always think that it can be miliary dissemination. So actually in tuberculosis, you will see presence of multiple hypoechoic nodules. So you will see multiple, these are hypoechoic, that is completely black in color. So we will see presence of multiple hypoechoic nodules. They are not completely black also. Hypoechoic is when compared to the spleen, the echogenicity is less. That means when compared to spleen, they are a little darker. So you will see hypoechoic lesions or hypoechoic nodules which are almost 0.2 to 1 centimeter in size. Sometimes even hyperechoic nodules or even sometimes either hyperechoic nodules or either if you see hyperechoic, sometimes you can see hyperechoic nodules or we can see larger nodules can also be seen. But most common presentation is presence of hypoechoic nodules which are around 0.2 to 1 centimeter in diameter. Then in tuberculosis, one important thing is first you will see nodules, or we can say these nodules are nothing but on histology you will see granulomas in these nodules. So when these nodules and granulomas heal, so once they heal, they become calcified. So whenever they become calcified, you will see presence of small scattered, they are scattered all over the spleen, and they are seen as small scattered bright areas which are white in color, that is they are bright echogenic lesions are seen. So if you see, if the spleen is something like this, okay, and it is almost a little grayish in texture, grayish to. So if the spleen is something like this, it is even more darker, but just an assumption. Now you will see presence of, oh, okay, inside this you will see presence of bright echogenic lesions like this. That is whiter lesions are seen. What are these? These are nothing but calcifications. And all these will also have an acoustic. If this is the calcification, you will see posterior acoustic shadowing is also seen. That is posterior shadowing is also seen surrounding it. So you will see these calcifications have small scattered bright echogenic lesions with posterior shadowing. Then sometimes you can also see presence of splenic artery calcifications are also seen sometimes. Okay, so we will see all of these pictures. Okay, now Okay, first, this is a tuberculosis lesion, and here you can see the presence of hypoechoic. See, this is the echogenicity of the spleen. These are darker than this spleen, right? They are darker, they are blacker. So this is a hypoechoic lesion which is noted. And this is a little larger, right? Do you see? They are larger. And see, these are actually, again, you will see many, these are also hypoechoic lesions which are multiple. There are many, right? There are many hypoechoic these lesions. All these lesions which are seen in the spleen, and these multiple hypoechoic lesions are almost 0.5 to 0.2 to 1 centimeter in size. So this is the normal presentation which you see. Sometimes you will also see presence of larger lesions also, like this. This is a little larger lesion. It is definitely larger than 1 centimeter. Okay. And then these nodules, when they heal, they form these types of calcifications. So if you see, this is the picture of miliary tuberculosis, where you can see here these are echogenic foci. All these are echogenic. Didn't you see? These are bright white in color over the grayish background. So these are actually echogenic foci which are seen in the granuloma. These are due to calcifications. These are calcified lesions. And if you see, this is a zoomed in picture of this, where you can see the calcified lesions very clearly, right? Because they are, see, these are actually small, right? These are scattered, they are diffusely present here, they're scattered all over the spleen, and these are obviously they are echogenic foci. And if you observe carefully, you will see this shadowing also posteriorly. So you will see presence of posterior shadowing also clearly. Okay, so this is the calcified lesions of spleen, and splenic artery calcification is also seen. So we have a picture of that also. One minute. This is again a typical tuberculosis, where you will see these are again echogenic foci are seen. These are multiple echogenic foci are seen, and because they are scattered all over the spleen, these are multiple scattered echogenic foci are seen. See, this is the posterior acoustic shadowing. Posterior shadowing is also seen. That means around the behind this calcified lesion, you will not see any brightness, you will see darkness. So that is posterior shadowing is also seen. So this is actually a case of atypical tuberculosis of spleen. Similarly, this is actually a sarcoidosis, where you see calcified granuloma. Yeah. Now this is splenic artery calcifications. You can see calcifications here. So this is the splenic hilum, where you will see the arteries will pass through here. So you can see the splenic artery here also. You can see here also you will have splenic artery calcifications. This is the hilum, not this, sorry. This is the hilum, where you can see splenic artery calcifications are seen in the tuberculosis patient. And this is, see, sarcoidosis also presents with some granulomas. So these granulomas, while healing, they also cause calcification. So obviously here you can see the calcified granuloma which is seen here. So this is calcified granuloma which is seen in sarcoidosis. Right. So this is about the tuberculosis which is presenting as splenic nodules. Um, Thank you.